So this set of questions is on recent papers 2020, 2021 endodontics. The first question: monofilament sutures are used for root end surgery. The sutures should be removed after 12 days, 15 days, 2 days, 7 days. The answer given in this pulse is C, 2 days. If you have different opinion, please comments below. The second question: patient allergic to sodium hypochlorite, also allergic to potassium iodide, EDTA, chlorhexidine, hydrogen peroxide. The answer is chlorhexidine. Number 2: patient allergic to sodium hypochlorite, also allergic to chlorhexidine. The logic behind is that chlorine ion is present in sodium hypochlorite and in chlorhexidine too. Next question, number 3: INR level for undergoing extraction therapy should be 1.5, 5, 3.5 and 4. The answer is C, 3.5. Next question, type of splint used in cervical root fracture: rigid, semi-rigid, flexible, semi-flexible. The answer is flexible. Next, there is a well-defined radiolucency apical to premolar with no widening of lamina dura and normal pulp vitality response. What is that radiolucency? Though the picture is not clear, you can make out the radiolucency here between two premolar, and there is no widening of lamina dura, and also the history is given that pulp vitality is normal. So this is a normal structure, and the answer is this is mental foramen. So the next question, parodontalgia is associated with irreversible pulpitis, reversible pulpal necrosis, normal pulp. The answer of this question is irreversible pulpitis. Answer A. What is the situation shown in the picture? So is it perforation or perforation with ledge formation, jip or elbow? This is of course perforation but with ledge formation. So the answer is perforation with ledge formation. Now the next question, which technique has minimum chance of blocking candle with debris? This is question number 8. Focus on question number 8, AIMS June 2020. Which technique has minimum chance of blocking candle with debris? Stay back, modified stay back, crown down, balanced force technique. The answer is D, balanced force technique. Balanced force technique. Next, 9. Most accepted post-endodontic restoration in a premolar with intact crown with small access cavity. So in intact crown and small access cavity, we may, we don't have to give crown at all. So in this question, the answer is D, composite restoration to fill the access cavity. Now minimum voxel size in CBCT in endodontics is, the answer is B, 0.2. This may be a new question to you, so you can snapshot it. Maximum voxel size in CBCT in endodontics is, answer is B, 0.2. I will make some time a video on voxel size in CBCT, but in this video or in this series I am focusing only covering the questions so that you can accustomed with the recent questions. So the next question, laws of access opening, Crow's and Ranco law of symmetry applied to all except, it's A, maxillary molar. Maxillary molar. So this is also, you can snapshot it. This is a good question. Next, which method is best to avoid ledge formation? This is calm down, passive step back, step down, step back. Answer is B, passive step back. Now for ledge engage management, number 8 and number 10 file is bent at For ledge management, number 8 and number 10 file is bent at, the answer is A, 1 to 2 mm 45 degree. 1 to 2 mm 45 degree. Now the next question, which of the following is not considered as endodontic emergency? So if you read the question, acute periapical abscess, it's an emergency. Symptomatic irreversible pulpitis with no apical periodontitis, so it is also emergency. Next, symptomatic irreversible pulpitis with symptomatic apical periodontitis, it is also emergency. Last, asymptomatic pulp with chronic apical periodontitis, so it is not emergency because this is asymptomatic. So the answer is D here, obviously. Now the next question, in the given image, which scale is used for diagnosis? Just focus on the image. You can see a huge resolution here. So which scale is used for diagnosis? The answer is B, PAI score. Again, I will make video on the explanation later on, not right now. The answer of this question is B, PAI score. The next, what is the most stable landmark to check for access opening? Is it cusp tip, cement-to-enamel junction, gingival margin, normal dimensions of tooth? So the most stable landmark to check for access opening is cement-to-enamel junction. Now the next question, symptomatic irreversible pulpitis is an endodontic emergency and need immediate treatment. Antibiotic is not mandatory in emergency management of symptomatic irreversible pulpitis. So both true, both false, this true, this false, this false, this true. What is the answer? So don't have to see the options, just read again. Symptomatic irreversible pulpitis is an endodontic emergency. Yes, it is symptomatic, that's why it is emergency treatment. Need immediate treatment. Yes, we need immediate treatment, so this is true. Next, antibiotic is not mandatory in emergency management of symptomatic irreversible pulpitis. This is also true, because in symptomatic irreversible pulpitis we need to do access opening or emergency pulpotomy. Antibiotic is not mandatory, so the answer must be, this is both are true actually, both 1 and 2 are true. So answer is A. Next, tooth with irreversible pulpitis, obturation should be done. Answer is 0 to 2 mm short of apex. 0 to 2 mm short of apex. Next, calcium enriched mixture is used in rickets due to vitamin D deficiency, forms hydroxyapatite, permanent tooth restoration, paste after gingival surgery. The answer is B, forms hydroxyapatite. Next, identify the Wein's classification given in the figure below. So you have to go in your textbook to recapitulate the memory. So the answer here, Wein's classification, this is C, type 3. Type 3. Next, identify the type of Bertozzi classification given in the figure. This is type 3, B. The answer is B, type 3. So, what is visible in the radiograph below? Vertical root fracture, Bertozzi 5, apical lateral canal, periapical periostitis. You can easily see here, there is a vertical fracture. Where? Here, this is a vertical fracture is there. So the answer is A, 22A, vertical fracture. So last, some questions. Chip space in endodontics is space between canal and file. It is related to, answer is B, cutting efficiency. Next, what do we use to identify vertical root fracture? Vertical root fracture, this is D, flexible probe or plastic periodontal probe. Now cross section of K-flex is rhomboidal. Next, This is the last question. We will discuss the rest of the questions later. Thank you very much for patience listening.